Hello, and welcome to the complete question and answer audio series, Problem Solving for Nursing in NCLEX RN Exams. This is tape 1 in the psychiatric series. My name is Laura McQueen. I'm a nurse educator, consultant, and a clinical nurse specialist in adult psychiatric and mental health nursing. This tape is published by Meds Incorporated of Silver Springs, Maryland. In this audio presentation, I will highlight some important concepts related to the role of the psychiatric nurse, therapeutic communication, defense mechanisms, anxiety disorders, schizophrenia, paranoid behaviors, and medications used to treat psychosis. I will then review test questions from your complete Q&A book, followed by a discussion of each question. The role of the psychiatric nurse will be the first topic area reviewed. Engaging in a therapeutic relationship, the nurse and the client work together to meet the client's needs and facilitate growth. The NCLEX RN exam has many questions that look at the nurse-client relationship. Using the nursing process, the nurse works collaboratively to assist the client in achieving mental health and well-being. The nurse also works to develop a trusting therapeutic relationship. The nursing roles include counselor, teacher, advocate, leader, coordinator, and manager. To assist you in understanding these concepts, I will review 2 test questions related to the role of the psychiatric nurse. The first question from the book is in Test 8 and is question number 30. Which reads, the nurse believes that health education is important for persons with stress-related illnesses. After giving a client information about his medications, treatment options, and the role stress plays in his illness, she realizes that the client will most likely follow the treatment plan under which of the following circumstances. Number 1, if the nurse refers the client for supportive psychotherapy. Number 2, if the nurse involves the client in the treatment planning process. Number 3, if the nurse asks the client if she may speak with his wife. Or number 4, if the nurse recommends that he come in for weekly appointments to review his progress. The answer is number 2, if the nurse involves the client in the treatment planning process. The client is more likely to follow the treatment plan when he or she has participated collaboratively in identifying problems, setting goals, and choosing actions to meet these goals. A good tip to remember in answering questions about the nurse's role is to look for answers that show collaboration and provide for the self-care needs of clients. The second question, which relates to the nurse-client relationship, is in Test 4, number 69. The question reads, a client is awake at 1 a.m. He is irritable and tells the nurse that she is making too much noise and that he hasn't had a decent night's sleep since his wife died a year ago. He asks the nurse to get him a cup of hot tea to help him relax and quench his thirst. Which of the following is the best nursing intervention? Number 1, get the client the cup of hot tea that he requested. 2, close the door to eliminate noise from the hallway. Number 3, use techniques that promote relaxation and suggest a warm glass of milk for the client. Or number 4, tell the client that he should try to get some exercise so that he will be tired enough to sleep at night. The correct answer is number 3, use techniques that promote relaxation and suggest a warm glass of milk for the client. The correct response, number 3, has the nurse collaborating with the client to promote relaxation and sleep. The nurse is offering herself to the client by suggesting and bringing milk. Milk is also a sleep sedative. Choice number 1 has the nurse giving tea. Tea contains caffeine, a stimulant not recommended for sleep. Choice number 2 has the nurse closing a door when there was no indication that the hallway was noisy. Using relaxation techniques with clients is always a good choice. The next important topic is about therapeutic communication skills. Therapeutic communication techniques are essential to the nurse-client relationship. There are many questions on the NCLEX RN exam that address the most therapeutic nursing response. Practice will help you become proficient at selecting answers that improve communication and establish a caring relationship. A good tip to remember is that communication questions can occur in any setting, peds, hospice, crisis centers, and that therapeutic communication responses remain the same for each setting. In the next 3 questions, we will review some typical communication questions and concepts you will need to know. The first question is in Test 3, number 22, which reads, a 15-year-old client is being seen in the family planning clinic. She says to the nurse that she is nervous and has never had a pelvic examination before. The best response by the nurse is, number 1, all you have to do is relax. Number 2, it is only slightly uncomfortable. Number 3, what part of the exam makes you nervous? Number 4, if you want birth control pills, then a pelvic exam is required. The correct answer is number 3, what part of the exam makes you nervous? Asking what part of the exam makes the client nervous recognizes the client's feelings. This is a good example of the communication technique of clarification. The other responses do not address the client's feelings or concerns. Be careful not to read into the question. The nurse does not know if she wants birth control. You want to address the client's feelings of nervousness. A very important test-taking tip is to look for the answer that focuses on the client's feelings. Test 7, number 91. This is a moderately difficult question. Remember, it's important to answer more difficult questions to enhance your problem-solving and critical thinking skills. The question states, a nurse on the psychiatric unit poses a question to a client who either does not respond or mumbles incoherently. The nurse will best deal with the client's communication problems by which of the following actions? Number 1, sitting quietly with the client during their scheduled times without attempting to verbalize until the client indicates a willingness to talk. Number 2, continuing to speak with the client using short, clear statements or open-ended questions about topics that may interest the client. Number 3, continuing to encourage the client to talk by asking direct questions. Or number 4, filling silent periods by talking about herself. Number 2, continuing to speak with the client using short, clear statements or open-ended questions about topics that may interest the client is the correct response. The goal is to establish a therapeutic relationship with the client. Sitting with the client is very important, but remember, in dealing with a withdrawn client, you want to encourage communication. The nurse can do this with short, clear statements or open-ended questions. The first choice states to wait until they appear willing to talk with you. If your client is withdrawn, you could wait a very long time. It's better to initiate some verbal communication and begin earning trust. It is important to remember not to choose a response, as in choice number 4, that has the nurse talking about herself. Correct choices focus on the client's interest, not the nurse, and are not confrontationally direct, as in choice number 3. The third communication question is in Test 6, number 83, and has 2 issues to address. The question reads, a client is very irritable at breakfast. When asked if there's a problem, the client states that he was unable to sleep because of noise made by the staff on the night shift. The best initial response by the nurse is which of the following? Number 1, it must be very distressing to be unable to sleep at night. Would you like to take a nap this morning? Number 2, I'll report that to the supervisor. Number 3, maybe we can move you to a room further from the nurse's station when one of those rooms become available. Or number 4, why don't you close your door at night? Sometimes the nurses make noise and don't realize it. If you chose number 1, excellent. It must be very distressing to be unable to sleep at night. Would you like to take a nap this